Yeah, Eva, I was just going to ask, what is the metric today? Because you're absolutely right. There is no one that is assessing, are people doing better? Like that's not, and I think it may shock people. I mean, I'm sure
Exactly.
when you speak to people, you probably get these blank stares back, like, no, that's not possible. I mean, they're
What do you
they're
mean
trying
we're
to
not
take care.
measuring?
Yeah,
Yeah,
they're trying to take care of us. They care about if we are doing better, but health is not the goal of the system at this point. It's a byproduct.
exactly. Exactly. And what we're measuring are activities and volume. And, we like to
Cost.
say that we're measuring access, but we're not. We're not measuring access. Oh, if everybody gets a mammography, are we doing our job? Not really. Do we do we want colonoscopies for everyone? No, we do not. We want colonoscopies for the people that need colonoscopies, you know? And so um, in 2020, in full pandemic, I was the first Canadian to do my master's in value-based healthcare. It was interesting during the pandemic, but it was also very rich. And that's when we really started to learn like measuring outcomes that matter to patients, measuring outcomes that are real indicators of success for our healthcare systems. How do we actually prioritize, for example, earlier interventions, improving, being having a more predict and prevent approach rather than a break and fix model that we have now. And so there's a real paradigm shift, and it starts with, what do we measure, how do we measure it, and why do we measure it? And the ultimate why do we measure it, that ties back to why I'm so passionate about patient advocacy, is don't assume that the doctors who have very good intentions are going to understand all of the metrics that matter to patients. They they have their own perspective, which is very important, but it's incomplete. You need to understand what are the outcomes that matter to patients, and then you'll have better adherence, you'll have better outcomes. Sometimes people just, they want to be able to go back to their activities of daily living. They want, the things that are important for doctors, like the binary yes or no cancer. There are patients in palliative care, for example, that will tell you, I would rather live really well for 3 months than suffer the last year of my life. So, what can I do to do that? And sometimes that's a different kind of treatment or a different intervention or no intervention at all. It really depends. But value based healthcare really turns a paradigm on its head and says, don't assume, just measure, and then use that data to inform better decision making, better resource utilization. And what's good for patients is good for all stakeholders, but not vice versa. And that's what our current system does.